We want to remind our listeners that this program is for informational and educational purposes only and not intended to substitute for professional veterinarian medical advice, diagnosis, or treatment. The Animal Medical Center does not recommend or endorse any products or services advertised by Sirius XM.
Welcome to Ask the Vet with Dr. Ann Hohenhaus. This is the place to talk about your pets and get advice with a top veterinarian from the Animal Medical Center in NYC. Hear from the leading authorities on animals and ask your questions. Now, here's your host, Dr. Ann Hohenhaus.
Hi, everyone, and welcome to Ask the Vet podcast. I'm your host, Dr. Ann Hohenhaus, Senior Veterinarian and Director of Pet Health Information at the Schwarzman Animal Medical Center in New York City. On today's podcast, I'll be talking with Dr. Karen Shaw Becker, author of the best-selling book, The Forever Dog, Surprising New Science to Help Your Canine Companion Live Younger, Healthier, and Longer. It's a step-by-step guide to teach us how to delay aging and provide a long, happy, and healthy life for our beloved canine companions. I'm very much looking forward to my conversation with Dr. Becker and hope you'll all stay tuned. The Ask the Vet podcast is available on all major platforms thanks to AMC's long partnership with Sirius XM. Our podcast can also be found on the Sirius app. We hope you'll like and follow us to stay current on pet health news. The Schwarzman Animal Medical Center is the world's largest not-for-profit animal hospital here in the heart of New York City, and where your pet is family. If you've got a question about your pet's health, just email me and I'll answer your question on next month's Ask the Vet program. The email is really easy to remember, so if you don't have a pencil, I'll give it now and again later in the show. The email is askthevet@amcny.org. One more time, askthevet@amcny.org. And now it's time for our trending animal of the month.
It's time for the internet's most talked about animal.
This month's pet is Ruby, a 5-year-old German Shepherd Labrador Retriever mix who was recently adopted by Peter Bradley from Dorset, England. While out on a walk, Ruby saved her owner's life. Peter fainted from low blood sugar and fell into an 8-foot-deep ditch. And when he woke up, Peter realized he could not get out of the ditch, but he could feel his boots filling with water. And that's when Ruby went into action. The loyal pup stayed right at the ditch and kept barking and barking and barking to try and get someone's attention. Fortunately, Ruby's actions worked because someone nearby heard her shrieking barks and showed up to check on all the commotion and called for help. But Ruby kept at it. Shortly after Peter got home, he fainted and fell again, and Ruby stayed by his side, once again barking and barking and barking until help arrived. A friend of Peter's showed up and found Ruby lying over Peter, just like a protector would do. Paramedics were able to treat Peter at his home, and happily, he's doing much better. After an eventful few weeks with his hero, Ruby, Peter knows for sure that they were meant to be together. Great story. And now, I'm just delighted to welcome Karen Shaw Becker to the Ask the Vet podcast. Dr. Becker started out her career as a small animal clinician, empowering pet owners to make intentional lifestyle decisions to enhance the well-being of their animals. Dr. Becker writes and lectures extensively and serves as a health consultant for a variety of health-oriented organizations. Dr. Karen Becker is the first veterinarian to give a TEDx talk on species-appropriate nutrition, which has been a lifelong passion of hers. Dr. Becker's deliberate and common sense approach to creating vibrant health for dogs has been embraced by millions around the world, making her the most followed veterinarian on social media. Dr. Becker, I so appreciate you making time in your busy schedule to join me today. I think we have a lot to talk about.
Well, it's wonderful to be here. Thank you so much for taking an interest in Forever Dog, and I'm excited to talk about it. Thanks for having me on, Ann.
Well, it's a pleasure to have you here. And, I don't always have veterinarians on. We frequently have non-veterinarian guests. But when I have a veterinarian, I always ask, how did you get started in your career as a veterinarian?
Well, I thankfully grew up with very supportive parents. I grew up in Iowa, and I knew from the time I was a very little girl saving worms and birds and damaged insects and toads and frogs in my backyard. I just have a passion for saving animals. So I first became a wildlife rehabilitator, first a state licensed rehabilitator, and then a federal licensed rehabilitator when I was 17. And then I went on to get my undergrad degree in wildlife management, wildlife biologist, and then on to veterinary school. So I have been passionate about helping animals live their best lives for as long as I can remember.
So we get a lot of questions about what to do with wildlife. So what's the difference between a state and federal? I didn't know there was federal wildlife rehabilitators. I know to go to the website of the Department of Environmental Conservation in New York, and then I can find a rehabilitator if I need one there. But I had no idea I should be checking on the federal level too.
So they'll all be listed there on both state and the national websites for finding a wildlife rehabilitator. State licensed wildlife rehabilitators don't do migratory species. So they can do bunnies and pigeons, starlings. They can do animals that are indigenously local to your state. For any migratory species, that requires a federal permit, as well as raptors, hawks, eagles, owls, and falcons. So there are some differences in what animals state licensed and federally licensed rehabbers can deal with. And for many instances, state rehabbers are perfect and wonderful, but for some species, a federal license is required.
So folks listening out there, because it's springtime and that means there'll be baby animals like in your backyard and you will think their mother has left them, but they really haven't. Check the website of your whatever state department runs your wildlife rehabilitation. There's great information there and will help you to know if you should leave that baby alone or find a wildlife rehabilitator for that baby that you've just found. This is my favorite time of year because I got nest cams going all the time.
Yes.
Okay, so I digressed a little bit there, but that was an important piece of information for our listeners. So I want to talk about the Forever Dog, surprising new science to help your canine companion live longer, healthier, and younger. What was the catalyst for that book? Or was there a dog that was a catalyst for that book?
No, it is our innate desire to want to know exactly why old dogs live to be so long. So myself, as a proactive wellness veterinarian, I'm interested in the science behind why animals live healthfully, where some animals degenerate. They just get sick midlife and have a whole host of degenerative diseases and problems. So my interest, Anne, is in the science behind why things remain healthy and vibrant or why bodies break down and degenerate. And my co-author, Rodney Habib, is obsessed with the oldest dogs around the world. So he regularly tracks where all these old dogs come from. So he found Maggie, the 30-year-old Kelpie in Australia, Darcy, the 21-year-old Yorkie mix, also out of Australia. He found Bushki in Budapest, 26-year-old dog. He found Tigger from Austin, Texas, a 22-year-old pit bull, Augie, the 19-year-old golden retriever. He found all these dogs. And his question to me was, hey, if I go and do personal interviews with their owners and find out not only what owners did do to intentionally create long-lived dogs, but what didn't they do? What didn't they feed? Where didn't they go? What environments weren't their dogs in? So he just wanted to know the whys behind how intentional these long-lived dogs were in terms of parental choices. And so his statement was, I will spend a year interviewing the owners of the oldest dogs in the world. And then you take that information to the top geneticists, researchers, longevity specialists, epidemiologists, and then let's have them reverse engineer this. And many of these top tier scientists that I interviewed, actually, they're doing research on dogs because dogs and humans oftentimes have the same lifestyle related diseases. So dogs are becoming really good models for human lifestyle related diseases. So that's what we did. We found the information. We have the oldest dogs in the world, and we combined it with the best science in terms of longevity experts reverse engineering why those dogs did so fabulously well and for so long.
So I'm curious about the dogs that you found. One of the problems in this kind of research is we never knew who the dog's family is. Like if I live to be 150 years old, they would be looking at my family members too to say, are they all living or is she just different than the rest? And there are definitely families with longevity, but in veterinary medicine, we often don't know who our patients' relatives are. So for these old dogs that you visited, was there any family history of old dogs or any info on the families?
We don't have any info on the litter mates of these exceptionally long-lived dogs. But what we do have is some of the genetics and some of the DNA behind some of these extra long-lived dogs. And the researcher, Dr. Eniko Kublini out of Hungary, her and her team are specifically studying what she has deemed Methuselah dogs. These are these exceptionally long-lived outliers all around the world that they are collecting DNA from to determine how much of these extremely long-lived animals could have a genetic component to it versus it being environmental. So that is helpful. They have identified a few key genes in some of these extra long-lived dogs that could be obviously contributing factors to why they did so well. So there are research teams studying the DNA behind these dogs, but we don't have litter mates to compare it to, unfortunately.
Yeah, that is just such a challenge in any inherited disease research in animals. Is it people think that you only want to study purebred animals, but the reason the purebred animals are so useful in this kind of research is that you have their whole genealogy mapped out by AKC or the breed club or something like that. So as veterinarians, you and I both know that dogs get sick and die from a lot of the same diseases that our human family members do. And you stated that pet parents want to make good choices for their dogs, but they don't know how to make smart, science-backed choices to get their dogs to have vitality and health for a long time. So can you tell us more about what you advise pet parents about decision making to make good decisions and not harmful ones?
Such a good question. We do know as veterinarians, and you and I experience this regularly, that one of the most painful things we see in the exam room are owners or guardians that are dealing with profound regret. Regret is awful. And in a nutshell, we wrote this book to help pet owners not have regret and how we can best accomplish not having to ever say to ourselves, I wish I would have known then what I know now. The best way to accomplish that is through learning and growing and being able to have enough information to make the best decisions for the animals in our care. And if no one is advocating for the physical, mental, emotional well-being of our animals, by default, some negative consequences can occur. So what Rodney and I did, we really asked ourselves if we could provide all the tools to maximize a dog's well-being in one location in terms of all of the most latest research that we could ever put together, compile it in one resource, what would that do in terms of allowing people to make better decisions? And that's ultimately what we did with Forever Dog. We wanted people to be able to, if they've had regret, if they look back on a previous dog and they think, gosh, I just would have done things really differently, or if they have a new young animal and they want to do everything they can to reduce the likelihood of environmental or degenerative disease from occurring, then that is exactly why we put this book together. We know when we interviewed the researchers at the Broad Institute, the geneticists said for humans, they estimate that about 90% of disease is environmentally created, 10% were genetic. And what we found when we interviewed the MIT geneticists on dogs, they suggested that it was more of an 80-20 split, that 80% of the reasons that dogs degenerate and die are environmental factors, and it's 20% genetics. So there is a larger variant pertaining to genetics, but even that genetic component, it was so inspiring for me to realize that this term epigenetics allows some of these genetic predispositions that could potentially contribute to expressed consequences that animals could be harboring. Do we even have control over some of these epigenetic potentials? And that was actually really inspiring for me to learn as well. So to answer your question, We ultimately wanted to create a resource that put all the information about everything that these top tier longevity scientists told us in one location, one resource to be able to give every dog owner around the world the opportunity to read and learn before they potentially had to put some of these practices into action in terms of realizing mistakes that could be prevented by knowing more. So we just made one big resource.
So I want you to clarify for our listeners, what do you mean by epigenetic? Because that's not a common word that comes up here on Ask the Vet. And so I want to be sure that the researchers the listeners understand what you're talking about, because I can tell you've been talking to lots of researchers.
So I have. In fact, the person that was probably most inspiring to me in terms of the genetic aspects of dogs was Dr. David Sinclair. He runs the Harvard Longevity Lab, and he also does a lot of parallel research with dogs, because dogs and humans, they have mirrored the same diseases: obesity, cancer, diabetes, all lifestyle related diseases that humans and dogs equally succumb to. And it was Dr. David Sinclair that said, here's what's awesome. Certainly, dogs come with a set of genetics, and some of those genetics are just set. Obviously, you can't change them. However, the environment that's whispering to our dog's DNA that has not yet been expressed, which means our dogs are carrying, and so are we, a set of potential genetic expressions genetic variants that could be either expressed or suppressed based on how we live our lives and what our dogs are being exposed to. And it was really empowering for me to learn that we do have some control over unlocking those genetic predispositions and or suppressing them based on wise lifestyle choices. So epigenetics is this field, it's an emerging field of research that the factors, the environment that the dog lives in, the water that they drink, the food that they eat, the air that they breathe, the stress that they're under, has the potential to up or down regulate genetic expression.
Excellent answer. Thank you so much. So that people understand what we're talking about. The Forever Dog provides pet parents with important information. And in your book, you talk about a step-by-step strategy that has a very not surprising acronym for this book, and it's called the D.O.G.S, D-O.G.S strategy. I think the listeners would be interested in hearing about this. So do you want to outline that a little bit for people?
Sure. So I came up with this D.O.G.S strategy as an easy way to remember all of the things that as pet parents we need to be thinking about to intentionally create health and well-being. So the D stands for diet and nutrition. And obviously the foundation of a dog's well-being is hugely dictated by what they eat. Feeding our animals are something that we are doing on a daily basis. And we know that food has the potential to heal or to harm. So foundationally, what we feed our animals, how much we feed our animals, the quality of the food, the quality of the nutrients plays into an animal's overall vitality. So the D is pretty clear cut in terms of food matters, and making good food choices is a big chunk of this book. The second letter, O, stands for optimal movement. And optimal movement really is exercise. And we want to customize exercise around your dog's age, around your dog's body, around your dog's restrictions. Like if you have a 3-legged dog, or if you have a really old dog, and also your dog's personality. If you have a reactive dog that doesn't do well with other dogs, all of those variables dictate what type of exercise you give your dog. But the premise is dogs, all of them, from the Chihuahua to the Great Dane, they're wired for movement, and they need to move their bodies every day. And so optimal movement is the second pillar of health that we outline in the book. The third pillar of health is genetic predispositions. And that's this new field of study that talks about the fact that, let's just say you've recognized, oh my gosh, I bought a dog from a puppy mill, and my dog's mom and dad were brother and sister. And oh my gosh, this is the end. My dog is going to potentially have all of these horrible genetic expressive diseases occur midlife and die a miserable death early. That doesn't necessarily mean that it's going to happen just because you have a dog that potentially doesn't have an amazingly diversified genetic tree. And so identifying genetic predispositions is a really nice way of being able to preemptively plan for up or down regulating those genetic SNPs or those genetic variants. S of the equation stands for stress. And this was the component for me that was really eye-opening. Now, when you and I think of stress, at least for the most part, most of us think about emotional, mental stress. So how long are our dogs in a crate all day? How stressed out is our home environment for our dogs? Does our dog have separation anxiety? We typically think about stress in that capacity. But many of the geneticists and actually many of the epidemiologists also mentioned other types of stress that affect dogs. For instance, chemical stress inside the home, chemical stress outside the home, like lawn fertilizers and lawn pesticides. We had one toxicologist give us a paper that was a little shocking to us that your dog can have a 70% increase in the incidence of lymphoma if you are using professionally applied lawn maintenance services. That's a little shocking. And so that's a chemical stressor that pet parents should be aware of. And then there are veterinary chemical stressors as well. So we as veterinarians, we advocate the use of pesticides on our patients, and rightfully so. We don't want Lyme disease. We don't want a whole host of, we don't want fleas. There's a whole bunch of reasons why we intentionally put chemical pesticides on our animals, but those are also not without potential side effects. So the S stands for looking and evaluating all of the potential sources of environmental, emotional, chemical stress for our animals' bodies, as well as the physical stress, which means obesity is a physical stressor, arthritis is a physical stressor. So that S is a really big encompassing topic when it comes to managing all of those different types of stress.
I just want to go back to the genetic disposition or predisposition, and just mention that the other part of the other thing, that there's the general genetic predisposition, and you said, well, if the dog came from a puppy mill, but even if you have, there are definitely genetic predispositions to medical problems based on breed. Right now, lots is being said about Frenchies because they're the #1 purebred dog in the United States, but they've got some genetic issues in that breed that present health challenges to you and I as veterinarians. And so pet owners, I'm not saying don't get a Frenchie, but I'm saying get a Frenchie understanding what the things are, and find a veterinarian who is going to be good at helping you deal in advance with the anticipated Frenchie problems, or the problems associated with a Great Dane, or the problems associated with a Chihuahua. No one has a perfectly healthy life. No mixed breed dog does. No mutt of a human being has a perfectly healthy life. And so but I think what you're trying to get people to do is be aware that these problems are there, and then come up with a advanced plan as opposed to a reactive plan to the problem. Do I have that right?
You have that spot on. And as a proactive wellness veterinarian, I have made my entire career out of helping my clients, partnering with my clients to identify lifestyle obstacles before disease occurs. And not only does every animal that we love come with a set of genetic predispositions, but you mentioned, of course, we do as well. So one of the things that we suggest in the book, and that I also just suggest as a practicing wellness veterinarian, is if you have done DNA testing on your dog, use that to your benefit. For instance, I just rescued a dog, 12 years old, from a nursing home. His dad died in a nursing home in my town. I took this 12-year-old dog. The first thing I did is do a cheek swab, sent it off. And what I found out is that he's a Glenavon Mall Terrier, and he has the genetics for PRA, progressive retinal atrophy, that he is harboring 2 copies of this condition that could lead to, it's similar to macular degeneration in humans. It's just this potential for progressive blindness to occur. His vision now is fine. However, he's 12 and he's got the genetics that could predispose him to an eye condition. So the first thing I did for Homer when I identified this on his DNA test is I started him on things that naturally help support the eyes. I put him on lutein and zeaxanthin and ubiquinol, and I feed him a high antioxidant diet. I'm doing things to intentionally nourish his eye and his eyes and his eye health. So that's one example. If you have a Cavalier King Charles Spaniel, or if you have a Doberman, those breeds are predisposed to heart conditions. And if you happen to, whether you rescue them as an adult dog, or if you acquire one as a puppy, you can preemptively put these dogs that we know very well are predisposed to certain genetic related heart diseases. You can put them on a proactive protocol of taurine and carnitine, the reduced form of CoQ10, ubiquinol. You can put your dogs on heart supportive nutraceuticals and actually even foods that will help nourish the heart muscle, that may help reduce the likelihood of some of these diseases coming to fruition. It may prevent when these diseases show up, and it also could moderate the severity of the diseases when and if they do express themselves. So you can use your dog's breed as a roadmap to point to potentially the areas of their body that you could be supporting. If you have a German Shepherd and you have an athlete that is, you have a working dog, you can start your dog on joint support, the raw materials for cartilage repair and maintenance to help minimize production or the potential for arthritis later on. You can supply key nutrients to help protect the myelin sheath in German Shepherds to help reduce the likelihood of degenerative myelopathy occurring. So there are things we can do before disease occurs to help mediate as well as put off the potential for when and if this DNA decides to express itself. And so part of this is potentially partnering with a wellness veterinarian that can help you identify what your dog is, and or if they have a lifestyle that's somewhat abusive. If you have a dog that constantly is slipping and sliding around the house, that is high risk for tearing an ACL. And so there are things you can do both with supporting tendon and ligament health, but also around your house to minimize the likelihood of some of these related disease states expressing themselves.
So we've talked a bit about diet and genetic predisposition and stress, but we haven't talked about optimal activity. So people always ask me this question: how much should my dog exercise every day? What's the answer to that question?
Well, there is no cookie cutter answer. And undoubtedly, when you see a morbidly obese patient, that's a totally different exercise protocol than when we see our lean athletes. If we have a blind patient, they have a different exercise protocol than a 2-year-old, highly active German Shepherd pointer that needs to run. So part of our exercise suggestions comes about because of breed. You mentioned Frenchies or other brachycephalic or short-nosed breeds. Some of those dogs need a very moderate, temperate exercise protocol, so we don't get their heart rates up, excessively high. We want to make sure that they're not overheating. We want to make sure that certain breeds with predispositions are able to respire and take in enough oxygen. But the premise is this: we want to customize or tailor make an exercise protocol around each of our animals' individual physical needs, as well as their emotional and mental needs. So on a daily basis, generally speaking, our physical therapists, our animals, our rehab specialists will tell us that just like humans, 20 minutes of heart thumping, muscle building, tendon strengthening exercise is a really good starting point for young, healthy dogs. But the truth is, if you have a high energy dog that really needs to move their body, they need to potentially run at high speed, off leash, in a confined, safe environment on a daily basis to just get rid of some of that extra energy, for them to be able to express all that they want to do, as well as build the musculature and get their heart rate up to a level that allows them to be calm and relaxed at home later in the day. So I would say if you have a young, healthy dog, you'd be hard pressed to say you could exercise your dog too much. Now, you need to do it safely and within reason, giving adequate time for recovery. But all dogs, even the 2-pound Chihuahua, They are wired as athletes. So the key is to form an exercise protocol that your dog enjoys doing. That I think that's the other thing. Some dogs don't like to necessarily go on walks around other dogs. Some dogs don't like to swim. Some dogs love to swim. So the key is find types of exercise that you and your dog enjoy doing them, and then do them consistently enough. What research does show is after 72 hours of not exercising our pooches, muscle atrophy begins to occur, which means they begin losing muscle mass and shrinking. And we don't want that to happen, because muscle mass, strong, resilient tendons and ligaments are one of the things that carry our dogs into their senior and geriatric years without musculoskeletal degeneration. So you want to customize an exercise protocol that your dog loves, and then do it on a daily basis. And that's the goal for all of our dogs. And interestingly, when we interviewed the owners of the oldest dogs in the world, these dogs all had a tremendous amount of daily exercise. And it was done in a way that was not stressful to them, but they moved their bodies consistently. In fact, Augie, the 19-year-old golden retriever, still was swimming an hour a day up until the time of death. So daily movement is an important part of happy, healthy, long-lived dogs.
What a great ending for my conversation with Dr. Karen Shaw Becker. I want to thank her so much for being with us today. And I want you to not forget to read her book about the forever dog. First, I guess I should give you my email address, which is askthevet@amcny.org. You can email me your pet health questions and I'll answer them on next month's show. We're going to take a short break here, but when I come back, I will have the animal news. So stay right where you are.
We're back with Dr. Ann Hohenhaus on Ask the Vet.
Hi, and welcome back to Ask the Vet here on Sirius XM. We've got a lot of animal news for you today.
It's time for Animal Headlines, the biggest animal news from across the world.
First story up is a blue-eyed husky named Alex. Alex was rescued after being buried beneath rubble for 23 days following that devastating earthquake in Turkey. It was sheer luck that the work teams found Alex in the area because they were really scouting a location to build a temporary shelter for quake survivors, but they heard Alex's cries from underneath the rubble. It took them 2 hours to find the poor little guy, but they were able to rescue Alex, who was shocked and weak, but barely alive. He received medical treatment, and in all that devastation in Turkey, I can't believe this, they found Alex's owner. You can read more and you can see video about the incredible rescue if you simply Google dog rescue after Turkey earthquake. My heart, that one really gets at my heart. For cat lovers who are listening today, since we spent the whole guest interview talking about dogs, we're going to talk about a cat named Crash. Crash is an 8-year-old orange and white one-eyed rescue cat and is the first cat to win the Cadbury Easter Bunny tryouts. Not only will Crash star in his own Cadbury clucking commercial, but he will receive a whopping 5,000 smacker prize for himself, and he gets another $5,000 to give away to the animal shelter of his choice. So to see Crash in all his glory, you just need to Google Crash the Cadbury cat to see photos and video. Crash's backstory is that he was rescued from a devastating car accident that left him severely injured and placed in a local shelter to recover. He has a real quirky personality, and he became a full-time resident shelter cat because I think the people liked him so much they didn't want to give the poor guy up. And you can see his commercials by just Googling Crash the Cadbury cat. Over 13,000 wildlife photographs were submitted for the British Wildlife Photography Awards this year. You really should take a few minutes to enjoy the extraordinary winning wildlife photographs. You can view them online, and they're also available in a coffee table book with a foreword by Dame Judi Dench. You can find these photos at BWPA.com. That stands for British Wildlife Photography Awards.com. And if any of the listeners out there are wildlife photographers, the contest for 2024 is now taking entries. You just need to go to BWPA.com in order to enter your photographs. And our final story today is some exciting news from the Houston Zoo. They're celebrating their oldest resident, an endangered radiated tortoise named Mr. Pickles. At the ripe old age of 90, that's 90, Mr. Pickles is currently relishing life as a first-time dad. Yeah, you go, Mr. Pickles. His partner, no surprise, Mrs. Pickles, is a youngster of 53, and they gave birth to 3 babies, appropriately named Dill, Gherkin, and Jalapeno. This is the very first time as parents for both of the tortoises, so I think that congratulations are in order for the Pickle family and the Houston Zoo. You simply need to Google Mr. Pickles and the Houston Zoo to see more information and photos about the happy arrivals. Now, I'm just going to put a little AMC note in here. In 2022, the 2 oldest patients seen at the Animal Medical Center were a pair of 81-year-old tortoises, spring chickens compared to Mr. Pickles. And now we're going to go to questions from our listeners.
Okay, our first question is from Kay. I've been reading your blog about supplements and diets for cats with chronic kidney disease. What is your opinion of using moringa for this?
So first of all, Kay, thank you so much for reading my blog. And for those of you who don't know that there also is a blog in addition to Ask the Vet, you can go to www.amcny.org/blog, and you can see the blog. Or if you sign up for the USDAN Institute's newsletter, they send out the blog every week in the newsletter. So moringa is a traditional medicine coming from the drumstick plant from Asia, Africa, and South America. It contains a lot of vitamins and antioxidants, but I couldn't find any information that suggested that this traditional medicine or traditional plant therapy has any benefit in chronic kidney disease. The other thing that one has to be really careful about in using supplements and traditional medications to treat diseases is that they can have negative side effects. And what I found was that moringa has the ability to interfere with thyroid medication, high blood pressure medication, diabetes treatment, and also the liver's ability to metabolize medications. So moringa would not be a medication that I would consider using in any of my patients without some backup from someone who knows something about that medication more than I do. But it sounds like that one might not be a drug or a supplement that you want to start on your own. Just a general reminder is before you start any supplement, especially in pets on other medications, I think you want to check with your veterinarian, because sometimes these supplements will interfere with the effectiveness of a medication for a disease that your pet really needs to be treated for. Thanks so much, Kay, for the question. Our next question is from Diana in Queens.
Yeah, she asks, my family has 7 dogs. Sometimes if they overexert themselves or trip on a branch or sleep in the wrong position, they show signs of limping or discomfort. We live in Jamaica, Queens, and our primary care vet is always booked. My question is, are there any highly recommended pain medications we can get over the counter without a prescription? Also, I heard that CBD oil is good and can be effective, but I'm not sure if there are any CBD brands specifically for dogs. Thank you.
So Diana has discovered what all of us in the veterinary profession know, and that is that we are experiencing severe workforce shortages in the profession, not unlike a lot of other businesses who can't hire the employees that they need. and many of the veterinary practices are struggling to meet client demand. So my suggestion for Diana is that she should book an appointment now for her dogs whenever she can get it with her veterinarian and explain what the situation is so that the vet can make a plan. A video of the limping dogs would also be helpful during that video, because then her veterinarian can see what was wrong with the dog, examine the dog, and make a determination about what the treatment plan should be. Unfortunately, all the good pain medication for dogs are available prescription only. There's nothing like Advil for dogs that you can buy over the counter. So you need to go to your veterinarian in order to get the good stuff, shall we say. So thanks, Diana, and I hope that you see your vet soon and that they have a solution to the problem your dogs had, because summer's coming and they'll be going to the beach soon, I'm sure. Question number 3 comes from Julie in New York.
Julie says about 7 months ago, she brought home a 15-pound super mutt rescue dog named Milo, who's about 2 years old. Her DNA said that she's part Chihuahua, Yorkie, Mini Poodle. We think she may have CLM, but outside of that, she is in seemingly good health. I noticed that sometimes when she starts settling into a position, her tail twitches on her way down, and when she's getting up after a nap. She sometimes seems to drag herself up. How do I know if this is just a quirk with how she moves or if she might be in pain? It is so hard to show this behavior live to my vet because Milo only settles when she is comfortable. She's usually more anxious or alert around other people.
So thanks so much for that question. I have to say that I don't know what CLM stands for. So I can't answer that part of the question, but this is the perfect situation to video the super mutt as she gets up and goes down. Because when you get an appointment with your veterinarian, you can simply say, okay, here's the video, here's what's going on, and here's what's bothering me. And between the video and an exam, I think that your veterinarian will be able to either say, this is nothing that you should worry about, or make a recommendation for further testing and treatment. So a video is in order in this pet, as well as the 7 dogs of the last question. Question number 4 we have today comes from Karina.
Karina says, can you review microbiome in canines, including what the difference between prebiotic, probiotic, and the importance of looking at CFU and specific microbiota strains in supplementation?
So first of all, the microbiome, to review the microbiome, I suspect there's a book on it somewhere, because you have a microbiome, and so does your dog, on your skin, in your GI tract, probably in your reproductive tract, and the microbiome, which is the normal bacteria or normal organisms that live on your skin, in your GI tract. You probably have some in your ear. It's all those places where bacteria normally live and don't make you sick. They're part of how you function, is those bacteria that you have. So then prebiotic is something in the food that is not a nutrient for your dog or cat or yourself, but is good bacteria, food for the good bacteria that help keeps your normal body balance going. So a good example is pumpkin. A lot of times we prescribe pumpkin for dogs and cats, and we prescribe it for diarrhea or for dogs and cats that are constipated. And what pumpkin probably does is provide a prebiotic effect that causes the good bacteria to grow and helps reset the GI tract so that the pet doesn't have diarrhea, or help reset the GI tract so that the pet isn't constipated. So that's how prebiotics work. Probiotic is the bacteria itself. And that's why things like kombu, the Korean spicy pickle stuff, kimchi, and yogurt with live cultures are all forms of probiotics, because they've got bacteria and other things percolating in them that helps to reset the flora in your GI tract. Then Karina didn't ask about this, but I'm going to say it anyways, because if you start looking at your dog's bag of food, you might see synbiotic, S-Y-N biotic. And that is a product that has both pre and probiotics in it. When the experts in the microbiome of dogs and the use of pre and probiotics say that you should use a species-specific bacteria. So if you're taking a probiotic for yourself, you don't want to take a dog probiotic because that's a bacteria isolated from a dog. You want a human probiotic, and you want to give your dog a dog probiotic and a cat probiotic. So species-specific probiotic is important. I looked and looked and could not find a dose recommendation for probiotics. And that's what the CFU that Corinne is talking about. It stands for colony forming units, and that's the dose of bacteria in a probiotic. If you look at the National Center for Complementary and Integrative Health, which is a part of the National Institutes of Health, they recommend like 1 billion bacteria for people. But people are not dogs and cats. So I do not have a colony forming unit recommendation for Corinne. I really couldn't find one, and it wasn't for lack of looking. So Corinne, I hope that answers your questions about pre and probiotics in your dog. And our last question today comes from Rona in San Diego.
And she writes, I have a Maltese Terrier and a Bichon Poodle. And both had dental cleanings with anesthesia a week and a half ago, but they are both still trembling today. Before the surgery, they never trembled, and I don't understand why they are both trembling several times a day, long after the dental cleaning. I would really appreciate your thoughts about this. Will this trembling go away? Should I take them back to the vet?
So absolutely. Whenever you are worried about your pet and the behavior is not normal and it persists a week and a half, the vet needs to be alerted to this abnormality. But I would ask a couple questions, and that is, are the pups on antibiotics following extractions or treatment for periodontal disease? In which case, maybe it's not the dental cleaning, maybe it is an antibiotic that's making them have a little tummy upset. Or maybe they're on some other post-dental medication and it's making them not feel well. So always ask the question, what's different after the dental than before the dental? Because there might be something besides just the dental cleaning or the related anesthesia that's causing the problem. This is way too long for the anesthesia to be causing an issue in these dogs. So I'm sure your veterinarian can help sort this out and get your dogs back on their track. And now we're going to, I want to say, I'll give my email address one more time, and then we're going to take a short break. And our email is askthevet@amcny.org. And when we come back, we'll have news from the Animal Medical Center.
We're back with Dr. Ann Hohenhaus on Ask the Vet.
Hi, welcome back to Ask the Vets. It's time for the news from the Animal Medical Center. I'm sure that all of you who are our faithful listeners have heard me talk about AMC's U.S.D.A.N. Institute for Animal Health Education here on Ask the Vet. I thought I'd like take a deeper dive today into the Institute's Children's Resources section. Because not all children have pets at home, but we know that every child will encounter animals throughout their lives. And so to help children of all ages understand more about animals, the U.S.D.A.N. Institute has created a novel set of resources to help children explore topics in veterinary medicine, animal science, and responsible pet ownership. If you have an older child, and we'll call that junior high and up, if your child is interested in working with animals or thinking about becoming a veterinarian, then we have a great resource called How to Become a Veterinarian. It has information about how to get started, how to gather experience caring for animals, where to learn more about the veterinary profession, what career opportunities and specialties are available for veterinarians, and even advice for parents to help their child succeed. If you want more information or to download a copy of How to Become a Veterinarian or any of our children's resources, just head to AMC's website, which is amcny.org, and put U.S.D.A.N. Institute into the search bar. The USAN Institute for Animal Health Education also has a pet health library. It also includes important health videos like how to give a pill to your cat, a weekly newsletter, and a monthly online pet health event. And every single one of these things and the children's resources are all free. We hope that you can join us for our next online pet health event, which is 6 p.m. Eastern Daylight Time on Zoom. Registration for our events is always free, but you have to sign up because then we can send you the Zoom link. And if you happen to miss the actual live event, all events are archived on our website. And that part of the website, if you just put in USDAN, USDAN, events, EVENTS, you'll be able to find our latest and greatest events as well as our event archive. Now, we're getting ready to celebrate Poison Control Week coming up in April. And our friends at the ASPCA Animal Poison Control Center just published the top 10 pet toxins. Say that fast, everybody. For the first time, this top 10 list mirrors a spike in cases that AMC's ER has been experiencing as well. Here are the common signs of poisoning reported by both AMC and the ASPCA: vomiting, diarrhea, collapse, lack of coordination, weakness or lethargy, excessive drooling, excessive drinking or urination, and weird, unusual behavior. If you think your pet has ingested something that is toxic to them, you want to immediately go to your nearest veterinary emergency room. Or if that's a long ways away, start by calling the ASPCA Animal Poison Control Center at 1-800-426-4435 or the Pet Poison Helpline at 1-800-213-6680. Although a fee applies for both, once you pay that fee, if you take your pet to an emergency room, that emergency doctor can call for this under the same fee and get advice from Poison Control. So it's a really great service that both of these organizations provide. I want to thank my very special guest, Dr. Karen Shaw Becker, today, and a very special thanks to everyone who's downloaded the Ask the Vet podcast. Because of your support, Ask the Vet podcast has been ranked number 4 in FeedSpot's Best Pets Podcasts for 2023. We appreciate your support. I hope you'll email me if you have a question about your pet's health. We love answering questions here on Ask the Vet. And you can reach me at askthevet@amcny.org, and I'll answer your question on next month's Ask the Vet show. Don't forget to check the Animal Medical Center out on social media. Facebook.com, it's the Animal Medical Center. Twitter, it's AMCNY, and the same handle for Instagram. Be sure to like and subscribe to Ask the Vet where you listen to podcasts to always get the newest episode the minute it drops. I'll be back next month for another installment of Ask the Vet here on Sirius XM.